Introduction. Immune system illnesses are a category of diseases that cause hyperactivity or dormancy to the system. In case it becomes excessively active, the body targets its own tissues and destroys them. Lupus is defined as a lifelong inflammatory disorder with a wide variety of clinical symptoms which impact different organ systems. This paper focuses on lupus disease along with the dimensions of causes, symptoms, and types. Main body. Lupus disease occurs when the human immune system becomes hyperactive and damages normal and healthy tissues. According to Brazier, this disease is not commonly transmitted unless it occurs in rare cases when a woman gives birth to a child with the condition. The origin of lupus is unclear in many cases, though common triggers include genetic factors as the most common source. CDC states that lupus may be caused by family history, especially if a victim has a relative with the first or second degree of the condition. However, people of color seem to have a higher chance of contracting the disease than whites. As such, there is a need to provide special attention to the people of color by involving them through the provision of information related to the diseases. Environmental mediums such as chemicals and viruses are also known as lupus causative factors. The agents may come from smoke, exposure to sunlight, and certain drugs. Brazier points out that the disease comes with a wide range of signs, including skin rashes, which are caused by hemorrhages beneath the skin and the inflammation of the legs and the zones around the eyes. It is, therefore, important for people to avoid environments that can expose them to various chemicals and viruses when possible. Increased pain can be felt in the chest due to the inflammation in the heart vessels. The root cause of the problem comes from the thickening of walls in the heart valves, causing a condition known as endocarditis. Lupus can result in more severe bone tissue death, which occurs when blood flow to an organ's bone is poor. It results in tiny breaks and, hence, a collapse of the organ. There are 4 types of lupus disease, which include neonatal and pediatric lupus erythematous. It is a form of lupus that occurs in newborns and is known to come from autoantibodies flowing from the pregnant mother to the child through the placenta. Systemic lupus erythematosus. It is the most common and different from other types because it affects multiple organs. Besides, it is common among females within the age of childbearing and among Asians, African Americans, Hispanic and Native Americans. Research should therefore focus on why the disease only targets potentially bearing females. Drug-induced lupus is another disease that occurs after a person is exposed to a form of medication or drug resulting in an autoimmune response. Though the exact cause is not definite, it is assumed to be genetic as it mostly prevails in patients who are slow acetylators, specifically those receiving procainamide or hydralazine. The discoid lupus erythematous, which is characterized by scarring and photosensitizing the person's skin. It is thought to be genetic and affects mostly women of the African American race. Until the exact cause of the disease is established, it is important for doctors to firstly establish whether a patient can use certain medications or not. Conclusion. In conclusion, lupus is an inflammatory disease that has the potential to affect anybody within any age limit because of its hereditary nature. As such, it is not a disease that is only limited to a particular group of people. However, one can reduce the potential of contracting it by avoiding specific medications, smoking, and taking precautions during pregnancy. Healthcare experts should also try to reach out to people prone to lupus and teach them how to stay safe. StudyCorgi.com has everything you need for successful studies. Writing tools, informative articles, and essay samples. Come check it out!